Thank you very much, first of all, to Jamie for having me out here today at the Bullitt County Health Department to talk about my favorite subject, which is actually insulin resistance. My name is Olivia Stivers. I'm a nurse practitioner. I work with Elivate Wellness. We are located between Shepherdsville and Mount Washington, conveniently right on Highway 44. What we are is we're outside of conventional medicine. I spent 10 years in conventional medicine, but we are a functional medicine practice. And our goal is to help people optimize their health and longevity. So we do this through multiple things. One of these, we always talk about our pillars of health. So number one, we talk about sleep. We talk about nutrition. We talk about strength training. We talk about stress management, water. All of those things are very important, and then we build on top of that. So that's just a little bit about us, but one thing that we deal with a lot in our practice is this idea of insulin resistance. I want to dive into why it is more than just blood sugar control. When we talk about things like diabetes, I think we focus so heavily on blood sugar, which is true. Really, insulin resistance I like to call blood glucose intolerance. Glucose is sugar, blood glucose intolerance. But I want to talk about the mechanisms behind it, and we want to talk about root causes behind this condition. So, all right, so first of all, what is insulin resistance? Let's take a deeper look. So, insulin is a hormone. It is a chemical messenger. It's really important that we understand that. Its job, think of it as like a car. Its job is to shuttle blood sugar into the cells so that way we can use it for energy. So when you eat food that digests down to sugar enters the bloodstream, insulin drives it into the cell. So this here is a normal insulin response. You've got blood sugar out here in the bloodstream. This is an example of a cell. Insulin is like a car. Again, it locks onto these receptor sites on the cell and tells blood sugar, hey, flow in and produce energy. So when you experience insulin resistance, what happens here is the cell walls around become really, really hard and rigid. They're angry, and you'll see an example of an angry cell in just a minute. They're angry. It's telling insulin, hey, you cannot latch onto here. We're full of glucose as it is. We don't need any more. Don't come in. So this is where you have glucose intolerance or insulin resistance. Think of another analogy that I like to use is think of your cell as a suitcase. You're going on a trip, you pack the suitcase full of clothes, you go away, you spend your time out, on your vacation, you come back. Normally to go on another trip, you have to empty out those clothes, do your laundry, and put new clothes in. When you're insulin resistant, it's kind of like you're packing a suitcase, going on a trip, you're coming back, you're leaving the dirty clothes in, you're packing more clothes in, and you're trying to shove everything in there. Obviously, that doesn't work. Eventually, that suitcase is going to bust open. And it's similar, the same similar process is happening in your cells. So this is often a result of multiple interconnected factors. So chronic inflammation, we'll talk more about these. Chronic inflammation, gut health imbalances, stress is a big one. I can't stress that enough. Sleep deprivation and nutrient deficiencies, just to name a few. Okay, here's our angry cell. Okay, he is mad. He has rigid walls, impaired receptor sites. Okay, he's just like, ugh. Imagine if your cells feel like this, what does your whole body feel like? Like this. Our bodies are complex systems of multiple systems. These systems are made up of cells. If you look at your hand right now, for example, your hand is made up of multiple cells. If you look at it underneath of a microscope, they're all communicating. They're growing, they're dividing, they're replicating. That's how we stay physically alive, okay? If your cells look like this, they're not doing that process. Chronic inflammation is one of the things that will fuel insulin resistance. You have acute inflammation versus chronic inflammation. So we think of acute inflammation as actually a good process. It's anything that lasts less than 6 weeks. So an example of this would be if you have a virus, your body is acutely inflamed, but usually a virus doesn't last more than 21 days on average. If an inflammatory process is going on greater than 6 weeks, we then call it chronic. A lot of times we're still not aware that this process is happening. So this chronic process can last weeks, it can last months, it can last years, okay? So common sources of chronic inflammation are, number one, poor diet, processed foods, refined sugars, unhealthy fats. Number two, Gut dysbiosis, that's a fancy term, and all that it means is it's an imbalance of gut bacteria. So in your gut, we'll talk about this more, you have a healthy microbiome, or we should. These bacteria, you have like 3 to 5 pounds actually of bacteria in your gut, and their job is to break down food so that way you can digest and absorb nutrients. If you have too much or too little of this beneficial bacteria, it can cause some issues. Obesity. So it's hard to say what came first, the chicken or the egg in this instance, right? So insulin resistance can drive obesity, but also obesity can drive insulin resistance, all right? So obesity, visceral fat is an active inflammatory organ. Visceral body fat is the fat that you cannot see from the outside. So I, in practice, have actually seen relatively thin people with high visceral body fats. Visceral body fat, infiltrates your organs such as your liver, your heart, your digestive system. Think of it as like marbled meat. If your liver is marbled with fat, it's not going to go through that detoxification process that it needs to do to keep your body healthy. Chronic infections, so this would be like Lyme disease, for example. A lot of people are walking around with Lyme disease, they don't know it. Epstein-Barr or mono, CMV is another one. So there's chronic infections that could be playing in the background. And environmental toxins, we've heard of heavy metals, we've heard of mold toxicities. You know, there's a lot of things that we're exposed to every single day that could be driving this insulin resistance or this inflammatory chronic inflammation. All right, mentioned gut health. The unsung hero or villain of insulin sensitivity. Okay, so we talked about the gut microbiome. This has a vast influence on overall health. The gut, Hippocrates said it best, really, health starts in the gut. If we're trying to take care of our insulin resistance and we're not also addressing gut health, we're really kind of shoveling the sidewalk when the snow's coming down. Gut dysbiosis, or an imbalance of good and bad bacteria, can produce metabolites that negatively impact blood glucose metabolism, so how we use our blood sugar, influence appetite and energy regulation. So if you have gut dysbiosis, there are certain bacteria that can trigger your brain to crave certain foods. And energy regulation. So again, if you're not breaking down the food like you should, you can see where that would impact your energy levels. When you have this going on, it can cause intestinal permeability, aka leaky gut. Now, this term is used loosely a lot. We've probably heard of leaky gut before. I don't mean that your intestines are just spilling out bowel movement, okay? And you're like, you would be septic. That's not an issue. That's not what I mean. What I mean is these teeny tiny microscopic cells that line your intestinal tract are supposed to be pretty tightly joined together by these, like we call them junctions. But if there's an inflammatory process going on or gut dysbiosis, these junctions can kind of break apart. And when that happens, you release these lipopolysaccharides into the bloodstream. It's a fancy term. LPS. Or, can I say this? All right, little pieces of shit. So, lipopolysaccharides are inflammatory particles that are microscopic that go into the bloodstream that can keep this chronic inflammation going on as well.